If you have been experiencing any pelvic girdle pain, then this video is for you to give you some guidelines, some tips, some tricks for modifying the workouts within this platform. The most important thing that you want is information on what's happening, and then we're gonna set up that core foundation, that core breathing belly pump, to make sure you've got that solid foundation to apply in any of the positions that we're using. I've got my handy pelvis here, and this is what's causing you pain. Literally a pain in the butt, right? So you've got a lot of moving parts here within the pelvis, and no one's really sure what causes this pain. And it kind of gets lumped into just the category of pelvic girdle pain. It could be a number of other things. It could be a condition called sacroiliac joint dysfunction, where there is a dysfunction happening here in the pelvis. It could also be symphysis pubis dysfunction, which is here is your pubis symphysis, and there is a ligament or some connective tissue right here that could be shifting out of alignment as your pelvis grows, as your pelvis shifts. Baby placement is different. A number of things that could be happening. But the important thing to know is that you need to keep moving. If you become more stationary and try to not move, not walk, this condition is actually gonna get worse and it's gonna become more painful. So here are the things that you need to do. Put this guy down as I talk you through them. Your first step is to set up that solid foundation, as I already mentioned. Your core breathing belly pump, learning to breathe with your diaphragm. Make sure that that pelvic floor is a bookend to that movement, that we're turning on that core breathing belly pump. And this is important because it's going to bring you spinal and pelvic stability. Your pelvis is unstable. That's what's causing that pain. So everything that we can do to bring more stability into your body is going to help. And we know that that core breathing belly pump, you're strong on that exhale. You're strong when that canister is wrapping, hugging towards you. It eliminates extra movements or shifts in your spine and your pelvis. That's step one. Step two is to think about those moments when you're a little unstable. So you've probably noticed that you have more pain if you go into a big lunge or if you take your leg out to the side. Big shifts, fast shifts of your movement, transferring your weight from one leg to another. If this is already unstable in your body, we're going to avoid movements that are going to increase that instability. So it's exactly what I just mentioned. Standing with more of our weight on one leg, standing with the legs really far apart in any direction. We wanna make sure that we're utilizing our glutes. If you think of your glutes on the back of the pelvis, they're holding that pelvis in place along with that core breathing belly pump in the front. We want to make sure that when we're in those positions that we're using that proper activation of the hips and the glutes to hold that stability versus just letting it shift out of place. And we want to pay attention to where we feel strong. If we're training, we've got equal weight in both feet, we're coming down into a deep squat, there's no pain, we feel good. I want you to train there, and I want you to train hard, and I want you to feel really good about it. This is one of those conditions where if there's pain, your body's telling you to stop or readjust. If you feel good, keep going and know that you can strengthen in that position. Next thing is bilateral versus unilateral, which I kind of touched on already, is making sure that these positions that we're working in are stable underneath us. And that means training both legs with equal weight in all of our positions. If you're going through the workout and we've got something in a lunge, I usually cue you to bring more of that weight into your front leg. To keep you out of that pain for the pelvis, you may need to shift so you've got a little more weight in that back leg, but you're still gonna focus on firing that glute. So find those positions that work, stay out of the ones that don't. Some people feel better in parallel. Some people actually feel better in turned out. There's not a lot of research on this condition, and the research that's being done changes and completely disrupts everything that we've thought before. So you get to be your own experiment here. Note what feels good, note what doesn't. And I want you to also think about your stance and your range of motion. If you feel good in a squat to here, but you don't feel good in a squat here, you're gonna take note of that and you're gonna limit it. Your steps are gonna be a little smaller. If you're doing cardio, it's gonna be a little tighter underneath you. If you can even shift at all, maybe this becomes more about your arms than it does those weight shifts in the legs. There are lots of tricks and lots of ways that you can modify this workout in order to make it work for you. Just don't stop moving. You've got to keep moving. You've got to keep gaining that strength in the places that feel good. And be mindful of your flow. If we're doing a cardio, high intensity interval training and we're going up and down out of the ground, that's not gonna feel good on your body. So your modification is gonna be to take it here. This is your recovery versus coming down to the floor to get into that full diaphragmatic breath. All right, you've got some tools. Reach out to me if you need some extra help. I'm always here to talk.